we we are discussing. So imagine a virus so dangerous that just a few drop of infected fluid can spread infection. You can do that, and a virus that can attack multiple organs, cause internal bleeding, and kill within days if not detected early. Right now, Ebola outbreak is part of Africa, and it's rising. It's raising concern again, and many people still don't fully understand how this virus spreads, what the symptoms looks like, or how to protect themselves. So tonight, we separate fear from the facts because awareness saves lives, early detection saves lives, and misinformation can also be very. So today on Oliver comment. No, in fact, I'll allow him to introduce himself to us. Then we can start our live. So, Doc, please introduce yourself to us.
So, good evening, please. Can you hear me?
Yes, I can hear you loud and clear, Doc.
Hello, please. Can you hear me?
I can hear you, Doc.
Hello.
Yes, Doc, I can hear
Okay.
you.
So, my name is Dr. Joseph Oliver Commey. I work with the Ghana Health Service. I'm the director in charge of the Infectious Disease Center. I'm a physician and an infectious disease specialist with a lot of public health interest. So, that is who I am. I have worked with Mpox, dengue, Lassa fever, and HIV TB. I haven't had experience of managing anybody with Ebola. It doesn't mean that I want to manage anybody with Ebola, but it's good for us to have a discussion about Ebola. So that's a little about who I am.
Okay. Thank you so much for the intro, Doc. Of course, we don't want to, in fact, we don't ever want you to manage anybody with Ebola. So, Treasure, you are welcome to our life. That skinny nutritionist, you are welcome to our life. Lucy, you are welcome to our life. Tonight, we are talking about Ebola. We want to understand what Ebola is. So we have Dr. Oliver Commey, Director for our Infectious Disease Center, for us to have this conversation. Amevo Bridget, you are also welcome to our live. So, Doc, um, basic so everyone watching us can understand exactly what Ebola is. What is Ebola and why is it considered one of the world's most dangerous viral diseases? And also, what does the virus actually do to the body once someone becomes infected?
Okay, so thank you once again. Ebola, it's a serious disease. It doesn't play at all. It's caused by a virus. And it's often said that it's fatal because close to about 90% of people, when they get infected and they are quite sick, may lose their lives. Sometimes people talk about to 60% of people who get infected, they lose their lives. That is why people call it a serious disease. It's also highly contagious in the sense that if I am living with the virus, and the virus is usually in the body fluids, the individual, and that infected body fluid gets into contact with you through a break in your skin or into your eyes, into your mouth. Your skin is not protected, there is a high likelihood that you will also come down with Ebola. So that Unlike other diseases where you may get into contact with the fluid that contains the virus and may not like that. Once I have it and you get into contact with my body fluids, be it semen, be it blood, be it saliva, be it vomitus, be it my urine, and you are not protected, you also come down with Ebola. To tell that it is a dangerous and
Hmm. When people hear Ebola, fear sets in. So tonight, we want to that fear. So, Catherine, you are welcome. Yes, you are welcome to our life. And you are now. One thing many people misunderstand is how Ebola spread. How does Ebola spread, dog? And I mean, spread from one person to another. And can someone get Ebola through casual contact, like shaking hands or being near an infected person?
it's a very good question you asked. And in that case, we are talking about the transmission of the virus,
Yes.
how the virus passes from one person to another person. The virus must be alive in a particular medium, a transport. The virus is present in people's body, fluids, like I said, and you see, if any of these bodily fluids gets into contact with infection, sometimes people surfaces that are contaminated with these bodily fluids, when you go and touch such that surfaces, you may also soil your hands, you may pick your nose, and then you may also pick up the virus. So it's through the bodily fluids. Once I have Ebola and you sit next to me and I am not bleeding, I am not handled, you will once I have, I'm sweating, I have diarrhea, I'm vomiting, then you can also get Ebola. Or I'm bleeding, then you may get Ebola. I hope I haven't scared people and I'm communicating, please.
I think sometimes scary can be good. Scary can be good. uh, yes. No. So, you were teaching and all. The symptoms can also be confusing in the early stages. Um, so, can we know some early warning signs of Ebola
Yes,
that people
I
should
can hear you.
that dog, you can hear me, right?
Well, um, can I go ahead?
Yes, please. You can go ahead.
Yes, I can hear you. Your line was the line is a little faint, but I can hear. Please, can I hope you can hear me?
Yes, I can hear you, dog.
Okay, so Ebola in itself, you may start showing symptoms sometimes between two to about 3 weeks after you have been exposed to the virus. It is not immediate.
Mhm.
The symptoms of Ebola, early Ebola, are like unusual malaria, usual typhoid, usual, let's say, urinary tract infection. So you may have a fever, you may have a sore throat, you may have some joint aches, you may feel tired when you walk. These things are just like you having coming down with malaria or typhoid. So sometimes it's very difficult for anybody to pick up the early warning signs of Ebola. When you start getting the wet symptoms, like the diarrhea, like the vomiting, like the running stomach, like the bleeding from your eyes, bleeding from your nose, those ones are more or less the danger signs, and it means that you may lose your life. So somebody might ask us, then how do I know that I have Ebola? That is a very important question and point we all need to understand. In this time, in this time that we are discussing Ebola, there is no Ebola in Ghana yet. We haven't diagnosed anybody of Ebola in Ghana yet. So that if you go to the hospital, you have these fever, job, we will say that malaria, or maybe it's typhoid. However, if maybe within the last 21 days you traveled to or to DRC Congo where the problem is coming, or you have attended a funeral of somebody who died mysteriously that nobody knows about, and you start having these symptoms, when you come to the hospital and you tell us, we will think about Ebola. So the key thing to help pick up cases of Ebola is the history of you having been somewhere, or you having been in touch with somebody who has traveled and has come back and is sick. So it's very important that when we go to hospital, apart from the symptoms, if you have traveled or you have come into contact, please tell us. Then we can help you early. I hope it is clear.
Very loud and clear, Doc. Very loud and clear. So if the symptoms are almost the same, the early signs and symptoms are almost similar, or but for history.
Hello?
Yes, Doc, we can hear you. You help us
Hello?
determine
I
whether
can't hear you.
the Doc, can you hear me? Hello, Doc. Dr. Commey. Dr. Commey, can you hear me?
Hello?
Yes.
No, I didn't hear you. I'm sorry.
Okay. Can you,
Please repeat.
you can hear me now, right?
Yes, please. I can hear you.
So, one major challenge experts talk about is diagnosis. Why can Ebola sometimes be difficult to diagnose early, and how can it be mistaken for diseases like malaria or typhoid? You've already touched on these a little bit for us. I think your light was breaking a little bit, but if you can touch on these ones, somebody is asking, how can it be mistaken for diseases like malaria or typhoid?
Okay, so like I said earlier on,
Yeah.
it's a viral infection. It's caused by a virus. And usually, when people have infection, the body will respond. How does the body respond? The body will respond by increasing your temperature, which is a fever. The body will respond by having joint aches and pain in your muscle. The body will respond by sometimes you having a sore throat. Because it's a viral infection, this is how it will present. The same way with bacterial infections like malaria, protozoal infections like malaria, and bacterial infections like typhoid. They present, the body reacts in the same way. It's your immune system reacting to something within your body. So it's very difficult for us to say that you have Ebola or you have typhoid or you have, what do you call it, malaria. But remember what I said. Ghana has never recorded a case of Ebola.
Yeah.
So when you go to the hospital and you are sick, we never think about Ebola as the first thing that we will think about. Unlike Uganda or DRC, and you are complaining of fever, joint pains, they will think about Ebola first, and then they will think about malaria and things second. Because we haven't had a case in this country yet, we are not thinking Ebola first. What will cause any of us to think about Ebola in a Ghanaian is that, oh, the Ghanaian says that I went on a holiday in, let's say, Uganda 3 weeks ago or 2 weeks ago. Whilst there, we met people from other countries and one of them fell sick. Then everybody will say, hey, that is like a history of contact with somebody. In that case, when you say that, I don't only think about malaria, I don't only think about typhoid, then I'll start thinking about Ebola. However, if we don't pick it early and you get to the later stages, then you may start bleeding from your mouth. When you go to the washroom, you may see blood in it. Anytime we see such things in Ghana, we start looking for Ebola and all the diseases like yellow fever, another one like Marburg, that will cause people to bleed. I hope I have been able to clarify. So
Yes.
it's very difficult to pick Ebola in the early stages when there is no Ebola in your country.
Okay. Next, Connect GH. Welcome to our live. Trudy Bills, you are late again. Welcome to the live. Dizzy, welcome. And Nanyak, hey, you are live. Tonight we are talking about Ebola. So if you have any comments or any question you want to know about Ebola, just drop them in the comment section, and I will ask Doc for you to Doc to clarify on it for you, and also share this live for other people to join, like the feed to spread the life. Dog, let's talk about prevention now. What are the most effective ways people can protect themselves and their families from Ebola, and what should someone do immediately if they suspect exposure or any of these symptoms that you've mentioned?
Okay, so that we do not cause fear and panic, let us all learn and let's all that everybody has Ebola. I am the only one who hasn't got Ebola. So, how do I prevent myself from getting Ebola? It means that the key is simple things. Wash your hands always with soap and water, or use your sanitizer when you are in public. In that case, if by mistake you touch something that a patient has touched without you knowing, you would have washed that particular thing off your hands. Let's also know that typically Ebola patients, when they are sick, will go to hospital. So one of the biggest areas where we can pick up any infection of Ebola is in the hospitals. And remember that I said the Ebola can present like malaria, can present like typhoid. So if you don't look after, if, as a health worker, if you don't wear what we call the proper protective clothing to work, that may say proper, it doesn't mean go and wear Kaka Motobi suit. No, it means that when you are in the hospital, when you have to use gloves, you use your gloves. When you have to, and there's something we call the 5 moments of hand hygiene. Before you touch a patient, after touching a patient, after doing something for a patient, as a health worker, when you do these things, always remember to either use your sanitizer or you wash your hands. Those are the key things. It's called the infection prevention practices. Once we do them, we are sure that we can protect ourselves in the hospital. What? Because sometimes we have sick parents or sick relatives, and we are all very humane. Once somebody is sick, we want to look after that person. I am not saying don't look after the sick people at the moment, but once we start getting Ebola in this country, we will advise that anytime anybody is sick in your house, try and make sure that when you are coming into contact with the body fluids, your hands are protected. So you are wearing gloves. If you have to pick vomitus, if you have to pick the urine, if you have to pick the poo poo, if you have to clean anything, make sure that you are protecting yourself by wearing gloves. Somebody will say, if I don't have gloves at home, I'll say, put your hands in a rubber. Put your hands in rubber, tie it, and do those things because that is practical. You are putting something there to prevent your body from coming directly into contact with the body fluid that may contain Ebola. Let's say that what do we do when we go to gatherings? When we go to places where there are a lot of people, remember that in our culture, we tend to touch a lot of things. If you cannot avoid touching people, please use your wash your hands as often as possible or use your sanitizer. If you can, you will avoid a lot of handshaking and touching people in times like this. So we've spoken about what you do at home, we've spoken about what you do in public, and then we've spoken about what we do in the hospitals. Simple things: washing your hands when you need to wash your hands. If you need to wear a mask, you wear your mask. If you need to cover your face with the face shield in the hospital, you cover your face with the face shield. But as much as possible, protect your hands, either by wearing gloves, putting your hand in a rubber if you don't have gloves, or you are washing your hands or using sanitizer most of the time. I hope these are simple things we can do.
Yes, definitely, definitely. Yes, look, these are. I mean, we can go back in the days of COVID when COVID came. I mean, the simple practice that we were doing. This is very simple. It doesn't cost us anything. Yes. Smart wife. It's been a while since we saw you over here. I hope you are doing well. Emily Coffee, welcome to our live, and also Evelyn. Evelyn, you are welcome. Kweku, you are welcome too. Um, talk about fear during outbreaks and the panic that it creates. How can communities stay alert without spreading fear and misinformation? And also, what role does public education play during Ebola outbreak?
I first commend you for this particular engagement that we are having. When you have facts, when you have the real facts, and that can help people to dispel the fear and the rumors that will occur during Ebola. And I hope today will not be the first time we will do this, but we shall engage more often so that we can bring the facts and allay the fears of people. And once we do not do that, then the place will thrive on misinformation, myths, truths, myths that do not help anybody. So it's important that in times like this, we seek and we provide with the general public with the right information that they need. Also, it's important that times like this, if we hear the untruths, we quickly come out and make sure that we are helping people with the right information, and the right information will cause us to be safe. And one of the right information at the moment is that this typical Ebola virus that's happening, there, there is no vaccine, there is no drug that can cure this one. There is another Ebola virus called Zaire Ebola virus. For that one, we have some medications and we have a vaccine. But for this one, which is called Budibujo, there is no vaccine and there is no medicine. So this is fact. If somebody comes to say that this Ebola thing, there is a vaccine, that they don't want to give it to us because we are blacks. No, there is no vaccine and there is no drug for this particular one. It's one of the reason it doesn't cause much problems, but now we are experiencing it. So I'm sure maybe if it comes back again in the next 7 months, we would have found an antidote to it. But no, right information is that this one is Budumbuju, Ebola virus. The one that is common to everybody, the one that happened in Guinea and that happened in Liberia, the one that happened in Sierra Leone is called the Zaire Ebola virus. This one is Budumbuju Ebola virus.
So, Doc, how many types do we have? How many types of the Ebola virus do we have?
So the common ones are the Zaire Ebola virus.
Okay.
Then there is the Sudan Ebola virus. Then there is the Budumbujo Ebola virus. And then there is the Thai forest Ebola virus.
Okay.
But the common one is the Zaire Ebola virus. And then the Sudan Ebola virus. Budumbujo wasn't that common, but now it wants to show that it's also there. So yes, it's picked up a little bit.
Okay. And Doc, many people also want to understand treatment and survival so that, I mean, we can prepare ourselves very well. It's, I know you mentioned that Ebola is treatable, but how important is early medical care in survival? And also, why do some outbreaks become more deadly than others?
Okay, so let me start by saying that last year, outbreak of the Sudan Ebola virus in Uganda. But quickly, the Ugandan authorities were able to control it because they are very experienced at managing Ebola. So they know what to do. The populace understand. They cooperated with them, and then they were able to curb it. So the conditions were right. The population was supportive. They reported early. The people who were sick, and they managed to isolate them and looked after them. People did not die because they came out early. The current episode, or there are times where Ebola occurs and it goes out of hand. If it occurs in areas that are hard to reach, areas where we do not have doctors, we don't have nurses, we do not have the appropriate personal protective equipment, areas where we can fight over dead bodies, and we will not allow authorities to do what they have to do. There's so much mistrust, there's so much misinformation, there is war, there's civil strife, nobody trusts anybody. In that case, nobody listens to wisdom and nobody listens to reason. In such circumstances, Ebola will spread. May I ask all of us, do we have the same situation here in Ghana? So you will see that when Ebola should even strike in Ghana, because of the fact that we listen, because of the fact that we follow protocols like we did during COVID, it will not spread that much like it's spreading in DRC in the war area.
Okay.
I hope
And that. And so all too soon we are coming to the end of our show. But if you have any comment or you want to come on the show to actions, please let me know so that you join us and you ask your question. You can also drop your comment in the comment section, and Dr. Commey will do that to for us. So before we end tonight's conversation, uh, what biggest to the public about Ebola awareness and prevention, and also what simple action should everyone start taking immediately after the
Okay, so they say that when your brother's house or when your brother's beard is on fire, what do? You fetch water and put it down and also wait, just in case your beard will also go up in flames. That is what we are doing as a country. Somebody will say, but this Ebola is far. Where it is, if it was in, let's say, Nigeria, or if it was in Burkina Faso, or if it was in Cote d'Ivoire or Togo, then we shall get worried because they share land borders with us.
yeah.
But let's also remember that people now travel a lot and there are direct flights from Kampala, that is Uganda, to Ghana. There are flights from Rwanda to Ghana. There are people who jump onto the Ethiopian Air and fly there. So it is possible that Ebola can jump onto a flight and come. How do we prepare? At our points of entry, at our border points, we all need to be a little extra vigilant. We all need to be a little truthful to ourselves. If you have traveled to some of these places and you come to Ghana and you start feeling sick, don't jump from hospital to hospital to hospital to hospital. Sometimes you go to the first hospital, they say, oh, it is malaria. You know within you that you have traveled. You don't tell them anything. You will go to about 3 different hospitals. You are getting very sick and you're to any of these areas where this thing is going on. Say yes. No. Let us be truthful to ourselves. In our community, you see that there are certain strange things happening. People are falling sick. We don't know what is happening to them before they reach the hospital. They die. We bury them quickly because we don't want to people to know. When you see such things, please, when you see something, some of the things that we can do to more or less help preparedness of Ebola. Also, when we go out there, let's wash our hands with soap and water as much as possible. Very, very important. One of the key things you can do, use your sanitizers, wash your hands as if your whole life depends on that. Thank you very much.
So much, Doc. This is the Good Life chat room of the Ghana Health Service, and tonight on our TikTok live, we are talking about Ebola, understanding Ebola. We've talked about the symptoms, the prevention, how it spread, and what to do. Doc, we can you briefly touch on the preparedness of the service, what the implementation Ghana Health Service is putting in place in order to prevent these diseases, or even I mean, when it comes to this, when it comes into our country.
So I must say that it's a whole nation that is preparing. So it's led by, definitely because it's health, the Minister of Health, and then the implementation is mainly led by the Director General of the Ghana Health Service through the Public Health Division, through our Health Promotion Division, through the what do you call it, Institutional Division. So what is happening is that there are what we call the pillars that respond to people to coordinate. Those are the Director General and the Minister of Health, Director Public Health. And then there are people who need to make sure that we are communicating. That is the Health Promotion Division. So I'm sure people very soon will start seeing the the jingles. Very soon, people will start seeing the adverts, the things that we with some. I'm sure these things will come up. Then the other part is since we best thing for Ebola to come into the country is importation at the point of entry or somebody bringing it to this country. We are very alert at our borders. We are very alert at our points of entry, the airport. We are screening, especially more closely, airlines that are coming from. We are not stigmatizing them. We are just being prepared and just being cautious as a people. So we are taking great precautions. Then we have made sure that there are what we call the infectious disease centers. Some facilities have been earmarked. The people are being trained so that just in case somebody is sick, we will know what to do. Also, somebody may be sick, but if you don't test the person, you will not know. So currently in the country, there are about 4 labs that can help us to test for Ebola, and they tell us that within 48 hours, we should know whether you have Ebola or not. So these are the things that we are putting in place. Minister has gone round, Director General has gone round, and I'm sure in the next few days, we shall see more things on radio, on TV to help prepare or to help assure the Ghanaian populace that should Ebola raise its head, we shall cut it off.
Definitely, we can't wait. In fact, we don't even want to wait for raise the head before we cut it off. But look, now let's talk a little bit about media, the social media, the message. I know earlier we spoke about misinformation, but if let's touch a little bit on social media and our traditional media. How can they support public safety and responsibility? Responsible education during um, this emergency if we are to have Ebola in this country.
So you see, in this day and age, where information travels fast, especially through the social media, we can still use social media to promote or provide the right information. So that I'm sure this is a platform you have. There are others who have platforms. They should make their platforms available so that we, the experts, not only me, but others who know about Ebola, will be able to educate the general public. Also, we will say that when you hear a rumor, don't be quick to rumor. Verify it from a credible source. And once you have verified it and you are given the green light, you can go ahead. And I'm sure the Health Promotion Division of the Ghana Health Service, for which Good Life is also part of what we do, people can reach out to you. We should do more of these things. Maybe we should even do drama. Maybe we should even do talk show. We should do host people so that we can hear what the general public understands. And then we can also correct the mistruths.
Thank you. So I remember, Doc, during COVID time, we did some small tree drama B for COVID, and it really got people's attention. I remember. Yes, I'm sorry, it was Mpox rather. Yes, it was Mpox. Mpox. It
As
really,
imports,
yes,
yeah.
it really got people attention. Yes, I mean, I think it will really help if we all add our voices to it, especially our influencers. Yeah, they should add their voices to it, and it will help us. Florence, welcome. I mean, you are all late. You are all late. Happiness Ghana, you are welcome to our live. Doc, so somebody wants to find out what reassurance can you give Ghanaians about the country's readiness and public safety measures?
I will say that over the last 2 weeks, since we started about Ebola, the health workers have not rested. We have tried all kinds of things. We come up with a lot of plans. But our plans will not yield any benefits to Ghanaians if Ghanaians will not listen to the advice that we can give. So when we say let's all wash hands, and we've all listened to the advice and we wash hands, we will be safer. We say that when you are sick and you go to the hospital and you have traveled, have just returned from a travel, please inform the doctor, inform the nurse that, okay, by the way, apart from the fact that I have a fever and everything, if you care to know, I and they were UK. When don't stay at home or go to one chemical shop to the next chemical shop, rather go to a hospital. Tell them, hey, this is what is happening to me. Early suspicion and early diagnosis is what cause us to live, even if we have Ebola. But if we hide, if we are untruthful to ourselves, no matter the preparation we put in place, we will miss it. At the airport, let's say the port health officials will say, join this line. Then another person, don't mind them, come, I'll open this place for you to pass. Once you do something like that, once you go against what we are all preaching, you are opening the door for something to trickle in. So I believe that if we will all be each other's keeper, if each and every one of us will say, I don't have Ebola, I don't think you have Ebola, and we are preventing Ebola from coming in, so let's join our hands together and do what has been said of us to do, we shall we shall make good use of all the advice that has been given.
Okay, Doc. So NS want to find out, do we have enough isolation treatment centers in case of an outbreak? Do we have enough centers to accommodate people in case of an outbreak?
I will say that we are not praying for an outbreak.
Yeah.
I'm also saying that it will not be prudent to scatter treatment centers across the country. One thing I'm sure of is if we should get one case or two cases, I'm definitely we will end with those cases because we will listen to the contact tracing, we will give the information that needs to be given, and we will get that. But be that as it may, as a country, out of the 16 regions, I can say for sure that 14 of them have isolation centers. It may not be very big isolation centers, at least we can confidently say that we may have more than 100 beds across the country to manage Ebola if we have a national problem.
Okay. Dufie too is asking, what role do communities and traditional leaders can play in preventing and spreading misinformation of Ebola?
I'll say that if Ebola will start to spread, it will be in the community.
Yeah.
And in the community, we listen to our elders a lot. We listen to our opinion leaders a lot. We listen to our chiefs a lot. If Ebola should strike its head somewhere, we will beg our traditional leaders, we will beg our opinion leaders that when the examples or the instructions are given or the measures are given, they should own it, speak to their people, and tell their people that let us follow these things if we want to live. Also, when people are going around spreading misinformation within the community, traditional leaders should set them as examples that people will not follow such bad example. And I'm sure once our traditional leaders own the fight, own the response, and they join forces with the health, we can make good progress.
Okay, so thank
Hello.
Okay. Thank you so much, Doc. Yeah, Boatima, you are welcome to the live. Na Saku, you're also welcome. Kindly share this live so that a lot of people can join us to learn more about the Ebola disease. Doc, we have different people watching us. So now let's just some few minutes if you can touch on the prevention symptoms and all these in tree so that and how you can take care of yourself in case you have and the symptoms, yes, in tree, and after that also maybe in Ga for our tree audience and also our Ga audience. I don't know if you speak other language apart from this one, but if you can briefly touch on these ones first.
Right. Yeah, yeah, deliberately put me on the spot. You know, my tea is as if I'm walking somewhere. But then I will say that it's for Madam Asipi said, Maba, if you so, you can't Ebola ho asem. Me jidi se mate se, yare no Ebola ne nam mframe mu, nam mframe mu biya. Ebola yare no ewo ho. Ba ebi nye Ghana sisia ewo Congo ena ewo Uganda ya ewo Ghana ya ewo West Africa so far yente Ebola bia mokaya West Africa de ne 2014 na ewo Nigeria, Liberia, Sierra Leone and Guinea. For that time na yente West Africa country bia say wenya Ebola biom. Yanya Ebola bi last year. Na sa Ebola ne Uganda. But Uganda for no omo de Ebola no it say malaria wo ho. Ento omo nya ho pe no omo nim ne ombeye na omo asa ano. But eba DRC for no de bibia Ebola si wo ho no. Ho nkofo ye basa wo ho omo ku wo ho. Enti se nkofo ku kwa na ebetie any information. Then health worker na ebetumi akọ. Enti na yete say Ebola na spread no. Until Uganda there and shut spread there. But for DRC no there, a paya fabia. Na yemfa na say Ebola na say ofie hye. So ntina afie nim. Omo be pie akọ different places. Until hwe Uganda cases e wo ho nyina omo fe DRC no mo ko Uganda. Kasa there same way omo sa ye ho bai. Na bi Ebola ti efi ko. Advice to say you see TikTok live you betie the important things and niama ahodro say ye hwe so hohoro nsa ne samra hohoro nsa ne ye sanitizer o baby abekọ bia use sanitizer unya nsuo na wetu ya wash nsa so under running water wa wash nsa. The main way Ebola obi to nya Ebola ne say efa uhunsuo unipadua ne hunsuo enti emfa ne say wo tears saliva o moja ana bema ne hunsuo ana oba ne hunsuo ana obi a wafe sa niama na Ebola moawa ne wom enti say o nuante dia mama sa niama no so say Ebola de bi wo ho a wo so Ebola no so bi be ba wo ho na as yemfa ne say me wo Ebola na me hye me long sleeves ma hye me bibia na me tika mo na obetina me nchen a wo ho anka me a wonya Ebola no me ho nsuo anka wo ho nsuo a wonya Ebola ne enim from mo te say COVID patro yemfa ne say enim from mo te say COVID bibia tanya Ebola ye hospitals ada say omo a bia ye dead bodies ente obi wu warfi a ye wonnim ne akun ba kon wo pese da mo ko hu se mo na mo be kwa kwadwae ne wo ye fe ne se mo che ho sa nkofo no wo pray wa shoda ko pray Ebola body ho a wo kwadwae wa hwa na Ebola ne bi wo ho ente so those are some of the niema bia betumi afa so na e dia nya Ebola Currently, Ebola na ɛwɔ hɔ no, there were different types of Ebola. Baako a yɛfrɛ no Zaire Ebola, ɛna baako a yɛfrɛ no Sudan Ebola. Ebola wei yɛfrɛ no Budumbugio Ebola. Baako bi so wɔ hɔ a yɛfrɛ no Tal Forest, ɛna ɛwɔ Ivory Coast. Nti mempɛ sɛ mɛka Ivory Coast Ebola, but Ebola no were different types. Nea yɛwɔ sesia no yɛ Budumbugio. Ɛno bibi a yɛde bɔ ho ban biara ni hɔ, vaccine ni hɔ, drone ni hɔ, nti dɛn na yɛde bɛbɔ yɛn ho ban? Ɛyɛ sɛ wobɛho ne ntɛm, wobɛkɔ hospital na yɛahwɛ wo, sɛ ebi a wo ho nsuo asa na yɛama wo nsuo, sɛ wei a na yɛayɛ. Saa na mɛka afa Ebola no ho. Wei wɔ yɛbɛka sɛ yɛka saa wɔ twi mu. Anyame me kɛ m'ani bɔ me tue. Ɛngɔ na wakɛgbɛ kɛne GoodLife ha wɔ ne gbɛni wɔ banyɛ wɔ wie hela na kɛ egba mɔfɛn mo na hela na achɔle Ebola mwawa ekumeni kɛ Ebola ba achɔle virus ne viruses na kɛfɛ wɔ ka wɔn wɔ na me shimi wɔ kɔ aka Ebola ne mɔfɛn mo smo ka ɔka Ebola kɛ COVID virus me sha me fɛ viruses shi Ebola yɛ second yɛ ne university COVID akwejo keji shishi masmo no shishi na kaka Ebola virus le university ke professor se ke dilo shi COVID ka wi ke COVID e keji yo ka keji bi po han wo fen wo twi fan te achole te 2 years ago be me professor virus ba fi no we sana sa ke sani wo wi he ni mambi ane ale no ni wo yu o here shi no ko ma keji ka Ebola njenshie be kume onan ake tumomokone na atridi etumomokone na te achole te typhoid alomokone na malaria ewo mini ba ni odwen ake no ni fiobo ne ekule Ebola na eku betun ake ke ni bia na eje to ogbonjian wo he ocho ngbabo o sami efefla shi oli ake o ya sho hin ye kule ye Uganda alo ote holiday ko ye Congo no oba di mane me kani na je shit within the last 3 weeks cheme dan go me wo dwan ake kule ono Ebola she Anthony Ebola be wo mane mi wo kani ne kani bi je she wo ba ka ake kule malaria lo ke ka ote hospital no obodencho oli ake ekulo fangbe alo muko fangbe ne ba hin ocean ni ne ba le we hela mole ibo hele mo ba han wole ye hospital no ba join ne ke Ebola ne ba ihe chofa be vaccine ko be chofa ko be ni bo keke ni ko wono ko na no ba oya wo ba kwebo wo ba ha ke o henu eta wo ba ha bonu to atwa ke etukuleto o musu echon wo ba ha bo chofa no musu akpacho mo o shamoni agbene o fe ha wo ba ha bo bo ke nu ba ma ono ke wo fe ne kani bi ne oya o hia pata shi maso nye le ake Ebola le professor virus ni ko ke COVID po ba wo tun wo son COVID le nu class 1 alo ke bi a virus ni no ko ko no ba ke ji mam wo hia ma onukpa minister ke DG ameke wo fe ni bi ko me akemi ni wo forward da wo use o sanitizer ko te me aten kata me adi ke o elbow ashimo ke wonye wo fe ne kani bi ne wo me ke Ebola te hihie ko ni wo boy me adi tai ko nya ma wo bu no na ayu otwe ke wo follow ne kan bi ne fe e ba hie ha wo where you are don Prince, I hope you are okay.
Ofane oli oyi wala don. Dog, I hope I got it right. Oh, thank you so much, dog. You do. You've done. Thank you so much for having the session.
I'm
Yeah,
grateful for the
very
opportunity.
great. Salvatore, welcome, Baby Joy, and a lot of people also join this live. Thank you so much. Sorry, the importance. Sorry, understand Ebola. today on our TikTok show, we were talking about the chance of Ebola, just in case we get any outbreak here in Ghana. So far, we don't have any Ebola in Ghana. So far, we don't have any, but I mean, we need or we have to prepare towards it just in case we get Ebola. So we spoke about symptoms, preventions, a whole lot. During the week, we will be cutting it short by short and share them on our social media platforms. Good Life, Live It Well, TikTok, Facebook, Instagram, YouTube, all the social media. So if you missed this, come back again. I'm sure from tomorrow going, you'll find a bit of everything that we've discussed over here tonight, over there. We do this Friday evening, 8 p.m. to 8:30 p.m. And today we talked about understanding Ebola. And yes, we will have Doc again to talk about it. This won't be us. He will come back to talk about it. Thank you so much, everyone, for joining. This is the Good Life chat room of the Ghana Health Service. And next week, we will come back again. And we all know that Ebola is dangerous, but misinformation, silence, and delay action can be even more dangerous. The good news is this: awareness works, prevention works, early detection works. Doc spoke about all these things earlier in our prevention. So after that, don't spread fear, rather spread the fact. Protect yourself, protect your family, protect your community. Protect the community, because one infected person can save one informed person can save many lives. So see you next week. Don't go I mean see you next week in order to discuss. Stay glued to our channel, follow, share our posts that we've been over here, and I'm sure that when we see you next week, everything will be fine. So thank you so much tonight for joining us tonight live. Thank you once again for being here with us. Oh yes, our to thank you.
I'm here.
We are grateful. We hope to see you next week. All right. Have a good evening, everyone.
Treated net to avoid mosquitoes, malaria away. Good life, live it well. Enjoy your life. Use family planning. Breastfeed your child. Exclusive for 6 months. Nutrition for all. Good life, live it well. Wherever you day, whoever you be, oh, no matter your pocket, good life, good for you. You day for now, south, east or west. You be old or young, oh, good life, live it well. Wash your hands with soap under running water. Sleep on the treated net to avoid